Hi, my name is Amy Alcasabas, and I'm going to be taking care of you in preparation for your surgery today. So if you have any questions or need me to do anything for you, please feel free to ask. The surgery you will be having is a Mohs surgery to remove this basal cell carcinoma on your cheekbone. Your dermatologist and the rest of your medical team are hoping to be able to remove any trace of skin cancer cells on the bone. Now, the type of skin cancer that we are removing is a basal cell carcinoma, which is one of the most common types of skin cancer. Basal cells sit at the very bottom layer of the epidermis, which is your outermost skin layer. So when someone develops a basal cell carcinoma, those basal cells develop very abnormal, uncontrolled lesions that look like little red bumps or sores and are cancerous. This type of skin cancer commonly forms from exposure to UV rays from the sun, but fortunately it does not typically spread, so we are expecting good results. The doctor who will be performing the Mohs surgery on you is your dermatologist, who specializes in medical procedures of the integumentary or skin system. And what he or she will do is use a scalpel to remove a very thin layer of cancerous tissue, and that thin layer is then sent to a lab to be analyzed. And during this time, the dermatologist will construct a diagram to follow that will mark the surgical site. And then he or she will use the tissue sample to determine where to cut, and if there are more cancerous tissues, he or she will remove another layer of tissue. And this process of removing a tissue layer with a scalpel and analyzing it under a microscope for cancer cells is repeated until there are no more signs of cancer. How the surgical site is repaired is up to the discretion of the dermatologist. They may decide to stitch up the wound, or a skin flap or graft may be needed. And in some cases, the patient actually may be referred to a plastic surgeon, so the skin will heal best and reduce scarring. However, in your case, you'll be better off with receiving stitches. And also you should be prepared because more than likely the surgery will last for several hours, because the process of removing and analyzing tissue samples requires very precise detail and care, so that it ensures the best chance of cancer removal as well as less of a chance of scarring poorly. So it is very important to make sure you take care of the wound post-surgery in order to heal in a quick manner as well as to minimize scarring. And so please make sure you follow the dermatologist's instructions on how to clean and dress the wound as needed. And for your follow-up appointment, you'll be having your stitches removed, and you are scheduled to return in 1 week, and the doctor will remove your sutures, and you will be good to go.